Welcome back. Now, with less than a month before municipal elections, political leaders are currently visiting various communities to woo in voters. But there are fears that political campaigns may be super spreader events. To look more into this, we're joined by health expert Dr. Fundile Nyati. Mr. Nyati, thank you for your time and good morning to you. That's precisely the question. Should we be concerned with all the political campaigning that's going on right now? Could it be a cause for potential super spreader events and even this expected fourth wave?
Well, we must be concerned. We must be concerned because we do know that, yes, we've just gotten out of the third wave. However, we're still getting, infections, new infections in the country over the last 7 days, about 818, new infections, and the deaths as well, just around, 80 on average. So we are not out of the woods yet. And so the more gatherings that we have, the more the chances that there may be, those super spreader events. In fact, the government has been proactive in this matter because on the 23rd of September, they actually received, an advisory from the ministerial, advisory, committee, on COVID-19. And it actually highlighted the various activities relating to elections, the rallies, the door-to-door campaigns, and even on the day of the election itself, it's going to be very difficult, to enforce some of the things.
Yeah. So what do you think then can political leaders do at this point? I'm sure this is a first for them as well, because the more numbers they have at these rallies, the more confidence that they have that they might, of course, have voters obviously putting that X across their name and across, their logo there as political parties. So what do you advise that they do while, of course, keeping to as maximum exposure as they feel they need around this time?
Well, I think the good thing again is that I think the IEC has given some guidelines on what needs to be done, and each of the political parties has agreed, to adhere to those. But also the IEC itself, has been they have been able to take advisory from the experts on what needs to be done on issues of public health and social, interventions to mitigate the risk. But we are still likely going to see, an upswing, a mild upswing, of infections, in the build-up and also there, but not enough to make us worry that it will take us to the fourth wave. So that's what the experts are saying, and I agree with them. But we must continue to do that which is within our power. But there will be spontaneous rallies, and all of those things. The unplanned stuff is the one that worries the government quite a lot, because there are no measures to mitigate the risk. So I think it is upon each one of us as South African citizens to play our role in making sure that we do not unnecessarily, get to infect other people, and those who are positive must apply, for special voting, and those who have had contact must also be able to apply so that they don't go to the voting sites. Yes, it's very important to exercise your democratic right, but it's also important to make sure that the public health, is not worsened through your exercising of your democratic vote.
Right, Doc, I would like to just talk to you about, the vaccines and the vaccination drive that we're seeing at this point. We're seeing, the Vuma drive. We're seeing different pop-up sites, different stakeholders, even private sector, partnering up with government to open up these pop-up sites so that as many people can get vaccinated as possible. Do you think with the current vaccination drive we're seeing in the country at this point, that could prevent a fourth wave as well?
Look, as we speak, just about 25% of adults in South Africa have been vaccinated. That's still very low if we compare with the fact that we are aiming at 70%. So at this moment, the level of vaccination isn't at a level where we could avoid that. But what we are predicting, in the medical and the experts, is that the fourth wave, if it does come, will not be as high as the previous three waves, because of the, of the impact of the vaccination. But we must not be complacent. We must continue to practice, the public and social health interventions to mitigate that risk.
Very important message there. Always a pleasure talking to you, Dr. Fundile Nyati. Thank you so much for your time this morning.